Good day, everyone. Welcome to another episode of Collaborative Connections, a space for sharing and learning, sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. My name is Erica Clinton, and I will be your host for this episode. On today's podcast, we have Rhiannon Lewis. Rhiannon is the director of Essential Oil Resource Consultants. She is a practicing aromatherapist, educator, author, conference organizer, and host of the professional online international clinical aromatherapy network. Rhiannon's passion for making an aromatic difference at the bedside of sick patients has taken her all over the world as a speaker at conferences and as a facilitator of numerous advanced clinical aromatherapy programs. She is also an initiator of several important advances in the clinical aromatherapy world, including the introduction of personalized aromatherapy inhalers in settings such as cancer and palliative care. Thank you, Rhiannon, for taking the time to join us today.
Oh, thank you so much for your invitation, Erica. I'm delighted to be back. And first time as on a podcast with you, but not the first time with the Society for Oncology Massage, because I've visited you on 2 occasions to lecture at your brilliant in-person events. So
wonderful.
I'm thrilled to reconnect.
Wonderful. It's so glad to have you back. I was looking over things from those healing summits where you spoke, and people were so interested in what you were talking about and found the topic fascinating. So I'm so glad we could reconnect and you could join us today. So
Wow.
in looking at your bio, which is absolutely amazing, I want to start off by helping our listeners find out what inspired you to become an aromatherapist.
Oh boy, that goes back a way, Erica. We're stepping back more than 30 years now. But in my initial career path, I trained as a nurse. So I moved quickly into intensive care nursing, which became my specialty, because I really knew from an early age that I needed to be at the bedside of sick patients. That was really a drive for me. And so I ended up working at the bedside of the sickest patients in intensive care, but I found that there was still something missing. I still had some extra needs that needed to be fulfilled. And what I realized when I was in intensive care was that, yes, we were good with heroic measures and we were great at tubes and machines and keeping people alive and fixing things and, really working at the sharp end of acute care. But I became very aware that the person in the bed there, as an individual, was in great suffering, with distress, with anxiety, with fear, and with unmet needs, because we were taking care of keeping their physical body going, but, their mind and their emotions were not necessarily being addressed as fully as they could be. So that took me down a sort of another path where I thought, well, I want to be beside the person who's suffering. It's not about the medications. It's not about the tubing and the machinery and the politics of nursing for me. I wanted to be with the person and accompany them in their journey with their disease, whatever disease or what stage of that disease they were in. So that was the turning point for me. And so in 1989, I trained as an aromatherapist. It wasn't one of those, big aha, I had a dream moments. I'd love to say there was a big story behind it, but there wasn't. I just knew. I'd been using essential oils myself as a nurse for my own, care, for helping me sleep with shift work and, time changes and the stresses of working in such an acute setting. So I'd already seen them working on myself. And I started to wonder then, could not this be also beneficial for patients in acute distress? So my decision was then to step away from nursing and take a full-time training in aromatherapy, which I did in the UK. I live in France now, but I was living in the UK at the time. And that's really where it all began, because what happened then was I equipped myself with the knowledge and skills of aromatherapy, but my determination was to go back and still be at the bedside of sick patients. So I went back wearing a different hat and using different skills, but still able to really help people that were suffering. So that's really the start of the journey. And it's taken me on this amazing adventure, this aromatic adventure that's lasted, 34, 35 years and still fills me with passion to this day.
That's amazing. That's amazing. So, full-time training as an aromatherapist, can you give our listeners a little understanding of kind of what that looks like? What did you study? What were the necessary skills that you had to obtain to become an aromatherapist?
Right. Well, of course, 34 years ago, things were quite different to what they are today. And things in the aromatherapy world have evolved since. But basically, if you're stepping out, say, as I was all those years ago, my initial training equipped me with skills of anatomy, physiology, pathology, and some hands-on techniques as well, including massage and also optional add-ons such as reflexology or other manual techniques, as well as the study of the chemistry and the science of essential oils, of course, and their properties and how to use them, and then the practical applications, the different modalities, the different ways that essential oils could be used. Now, things have evolved over the years. Since then, the training has improved, the hours have increased, and the subject areas include now counseling in most courses, or at least basic counseling skills, holistic approach, holistic assessment, but still, of course, grounded with anatomy, physiology, pathology, chemistry, and the biosciences, really, because we have to understand the chemical cocktails that essential oils represent. They're not just many things in a bottle, these are really powerful tools that can be used for benefit, but it can also be hazardous if they're not correctly and appropriately used. So nowadays, if you're setting out on a career as an aromatherapist, you're looking at a training of upwards of 200 hours for a basic foundation course. Of course, that depends on which country you're in around the world and which schools you attend. But really, your starting point is around 200 or so hours. And then it goes upwards from there. So most of the big professional programs are a minimum of 450 hours. And there you can be accredited with different aromatherapy organizations around the world. So the basic curriculum is really revolving not just about essential oils, but also including health and the holistic approach to patient care.
A training feels so well-rounded as well, because you are basically administering this as a treatment strategy or a complementary therapeutic intervention. And that obviously requires a lot of knowledge, a great foundation in science, and an important skill set in the application of touch. So very, very interesting and very similar to what we do as massage therapists.
Indeed,
so thank you.
I think there is quite an overlap on some levels with massage therapists, because the way aromatherapy in at least the Anglo-Saxon world or the English-speaking world, or the English style, the British style of aromatherapy, how it really evolved was hand in hand with touch, and really using touch as a main modality for delivering aromatherapy care. But there are different styles of aromatherapy around the world. So the French style, for example, didn't evolve in the same way. It didn't evolve with touch. And so it came really from the medical side. And so essential oils are used quite differently. And there the training is different too. So they don't have necessarily the same holistic approach. They don't have hands-on practical experience, such as working with patients, case studies, mentoring, the full package. If you were studying on the French medical style, It's very much down to do with the aromatic pharmacology of oils, and the training may be shorter and just limited only to essential oils because they are such versatile tools. We can use aromatherapy for its aroma alone benefit without touch.
Mm-hmm.
Or we can choose to use our essential oils combined with other modalities such as shiatsu or body massage or reflexology, or even guided meditation, hypnosis. It can be sort of attached to other modalities in very simple, effective ways. And that's what's, I think, so exciting about aromatherapy, is that it can be a standalone treatment modality, or it can be an adjunctive modality that just adds that extra boost to what you're already doing and what you're already trained in.
Wonderful. So that's a good lead into my next question. Why is aromatherapy so effective? I guess in either perspective, keeping people well, or when they are, let's say, ill or affected by disease.
I think a lot of people these days are disconnected from nature, and there is a hunger to connect with nature. I think it's a hunger that perhaps we're not even conscious of. But when you meet a fragrance and you inhale an aroma that takes you to a forest, or it takes you to your childhood, or its familiarity reassures you, or if the therapist has used that aroma to deliberately set up a positive odor association that you can then use to therapeutic benefit on your own subsequently, these are very, very powerful tools, because the aroma part of aromatherapy takes us to a place immediately of like or dislike. It takes us to a place of comfort and positivity. And I think we need that. And especially in these current times, which, we're dealing with high levels of stress, high levels of distress, the aromas are able to take people into a place of balance, because there's security there, there's familiarity. And if you like a smell, it's a reward. So you have that whole neuroendocrine cascade, which really does you a lot of good to your mind and your emotions and your mood and your behavior. So just working on its own, just as a fragrant modality, when we connect with fragrance, we're connecting with the natural world. Our essential oils are all derived from aromatic plants, and they speak to us, and they take us on all sorts of journeys. And what aroma is meaningful to me is not necessarily the same aroma that's meaningful to you. So you have to enter into communication with the smell. And that entering into the communication just on its own is sufficient to slow your breath. Because inhaling an aroma and becoming aware of an aroma, you automatically adjust your breathing pattern. And so, it takes people to a place of calm and centeredness, even without them realizing it. So that's on one level, using pleasant aromas. And of course, aromatherapy is always about something that the person likes and that they identify with and that they find pleasant. It's a huge precept of what we do. We go for the aromas that are meaningful in a positive way for the person. But then you've got the other side of it, because we have, in a single essential oil, it's like a chemical cocktail. So you have different chemical constituents that the plant has made, and some of them have been made through the process of extraction, whether they were distilled or the different routes by which essential oils can be extracted from plants. And that chemical cocktail also can have pharmacological benefit. So we have mind, emotional, and mood benefit largely through the sense of smell. largely through our positive associations or our recognition or our liking of an aroma. And that takes us to a very special place in terms of body-mind balance. But we've also got the pharmacological potential of essential oils, where we can actively choose certain constituents or certain essential oils to address very physical issues such as pain or nausea or infection or a skin issue, for example. There we may be relying on the actual physical properties of the essential oil to repair a wound or to help with scarring or, you know, work in a physical dimension. So they're so versatile that really they have a place in both. Going back to your question, they have a place in both wellness and disease, because helping maintain our, what we call in French, our capital santé, which is, you know, our core health, your essential oils are really good for that because they take you to that place of homeostasis and balance. So as a result of that stress reducing response that you have with a pleasant aroma, you're strengthening your own constitution. So as a preventative regular treatment, especially if it's combined with touch, because we know then, you know, massage and all the psychophysiological benefits of touch, if you combine that with essential oils and the aromatic part, you've got this double whammy effect that is really nurturing for keeping people well. And then when people are unwell, your essential oils, as well as with touch, of course, as all of your members know, they can help people come back as well and find a place of balance. On a physical level, if we're talking about the physical qualities of the essential oils, their pharmacological properties, but also on a mind-emotional level, when we're applying them through touch and through our nurturing approach, and when the person's almost embalmed in this scented experience, it is really extraordinary. And that builds odor memory. So what happens is that if you're giving a massage and it's fragrant, the person is associating, not consciously, but they're associating the positive impact of your hands on them and all the positive benefits they're getting with treatment. They're associating it with the fragrance that you chose. So then what happens is after your treatment has ended, you can just give them the fragrance. They don't have to wait a week or two to get another massage. If they have the fragrance of what you used in that treatment and they inhale it, they relive the positive benefits of your hands-on therapy. And it's not just, you know, remembering, oh, that was nice, it takes me back, it helps me remember my massage. You actually physiologically relive. You actually have that whole neuroendocrine cascade occurring again at the same level, just through smelling and taking you back in time in your memory, your lived memory, to your treatment. And that's work that's been confirmed over the years by amazing people like Rachel Hertz, a great neuroscientist, where she says, you know, you relive your treatment. You relive the experience when you were presented with an odor and you had a strong positive experience and the odor was present. When then you smell that smell again in the future, you then go back to that positive experience in all of its form. It's truly incredible.
That's amazing. Just even thinking about that, making that powerful physiological connection through smell.
Just
right?
Yeah, it's an odor conditioned response.
Mm-hmm.
And a lot of what we do is exactly that. As aromatherapists, we deliberately create an odor association. So it might take 1 or 2 treatments, maybe more, and it's always, you know, the treatment is given in the same way, with the same aromas, in the same, you know, control the conditions as much so that you're reinforcing the experience. And then all you need to do is give the person a stick or an inhaler stick or the same blend on a tissue that they then use in self-care. And I think that's the other thing about aromatherapy, is that it's empowering the patient. With massage, you have to wait till the person comes back to massage you again. Mm-hmm. Whereas with aromatherapy, you can self-administer your care. And just knowing that you can do that, this is what's awesome, is that we know this now through experience, is that just knowing that the person has something they can do when they are anxious, or they're breathless, or they're nauseated, or perhaps they have procedural anxiety and they're sitting there waiting for their next scan, for example, having scanxiety. They know that that stick or that bottle or that fragrance strip or that patch that's aromatic, they have it at their disposal if they need it. And sometimes it doesn't even come out of the bag or the pocket. But the fact that the person knows that they have it actually reduces their experience of those symptoms. And that's really awesome too. It's really powerful, especially in oncology care.
That's amazing. So would you say with oncology patients, a lot of the aromatherapy usage is really about dealing with the myriad of negative side effects or symptoms like anxiety or sleeplessness that they go through?
I think the main contribution of aromatherapy in oncology care is psychosocial support. It's about helping that person along that trajectory, which, you know, is such a roller coaster of their disease, from diagnosis right through to survivorship or through to end of life. That whole disease trajectory has such heightened emotional experience, a lot of which is negative, but not always. But the fact that essential oils can be used to accompany the person in that journey, but as a psychosocial support measure, that makes absolutely all the difference. And then the next level is that we can use essential oils to directly address symptoms. So I would say that symptom management is secondary to psychosocial support, because in fact, when we help the person cope better and increase their resiliency in their disease trajectory, they often are able to self-manage a lot of those symptoms, and the actual experience of those symptoms automatically reduces when they are less anxious, for example, or they feel that they have more control. And then you can come in and look at how you can address specific symptoms, such as chemo-induced peripheral neuropathy. That's a big one for me. That's one of the areas I've specialized in. Or nausea related to chemo or other medications or their disease itself, through to skin breakdown, through wound care, infections. Then you can really go down and use your oils in clinical ways to address directly physical symptoms. But the main thing is really working with helping resiliency, helping with psychosocial support is absolutely fundamental.
Yes, and the concept of resiliency is something that I think people don't focus enough on in care. And now, particularly, I think in cancer care, the realization is that the more resilient we can help people to be, the more likely they are to manage their disease process better, even if it doesn't lead to a cure, but it helps tremendously.
I think it does. And, you know, I think that empowering is important. You know, it's about helping them take the reins, because that roller coaster journey, so much is out of their control and so much is negative or painful or uncomfortable. They didn't choose this. So, you know, by using a modality that offers them choice, that offers them something pleasant and really nurturing, and something they can then do themselves to control their symptoms and to manage, is helping regain a bit of control. And I think, whether it's touch or whether it's aromatherapy or whether it's both. I think that's why massage and aromatherapy have such a strong place in oncology care. It's really, really, really essential.
So the benefits huge. Are there any risks?
Yes, I think there are. First of all, just to explain, when we use essential oils in oncology care, if we have specialized training in as a specialty delivering aromatherapy in clinical settings and with oncology care. So that's usually an additional training to that foundation that we were talking about earlier on. It may be in-house, it may be in a hospital or a hospice or in a clinical setting, but there and this is where I've been educating since 2003 at a Royal Marsden Hospital in London. There we have specific training of how to use essential oils safely and effectively in the cancer care world. And what we found over the years is that, generally speaking, when we use essential oils topically for patients, we're working at very low concentrations. So we're working at half of the normal concentration that we would be doing for a general aromatherapy massage, for example. We take the dose right down. And when we're working in those very low dose scenarios, the risk to the patient is really negligible because there's just not sufficient components of those oils, even if they were potentially hazardous, to even really make a difference to that patient in a negative or in another way. Having said that, of course, we also only use essential oils with a very long track record of safety. So we're not using challenging or potentially toxic oils in oncology care. There's a kit of maybe, say, 20, 25 essential oils that have been used for more than 30 years in the oncology setting that have been tried and tested, and, their benefits far outweigh any potential risk. Where I would say there is a risk is really that odor and aroma reactions are so unique to the person. And when we're working in an oncology setting, it's a high stress environment. So when there is heightened attention and heightened distress, any aroma that is presented to the patient can become negatively associated with that person's experience. So, for example, I'll give you a concrete example. You're in a chemo suite. So you have patients that are receiving chemotherapy and aromatherapy is being delivered in that setting. If the essential oils were diffused into that space, even with the intent of making it a nice, quiet, calm space to relax people whilst they're having their chemotherapy delivered, if that person doesn't like the smell, if their odor preference is not that particular oil that is being diffused, they don't have a choice. They have that aroma in that space around them and they can't get away from it. And if that chemo experience was very negative, perhaps it provoked vomiting, or perhaps there was extravasation and it was painful, or they had chills, or they had, negative physical experience to the chemo delivery, that strong, distressing experience is now being anchored with the aroma in the room. And so now, the next time that person smells that smell again, what is it going to remind them of? We talked about positive odor association a few minutes ago, but this is an example of negative association. So now that aroma that was being diffused with the intent to make things, more pleasant for people might actually now be the trigger for taking them back into a negative odor memory with all of the physiological experiences that could happen. So that's an example of where you could say could be argued as a negative bit of the aromatherapy puzzle. And that's why in a chemo delivery, for example, if there's a chemo suite and people are receiving massage and aromatherapy, it's not done through diffusion. If the person is having essential oils, it's usually for self-control, self-management, maybe in a stick, maybe in a patch that they can choose when and if they smell it, and that it is just for one person and the person next to them isn't aware of the aroma. So we can get around the possible negative experiences. However, even that is unlikely because most times aromatherapy is perceived to be positive for the person. So what they will remember about that aroma is that that aroma helped me get through my chemo. That aroma calmed my nausea. So even if it's in a situation such as oncology, 9 times out of 10, the aroma associations would be positive ones. But that is an area that we'd need to consider. And then, of course, you need training, you need skills, you need to know when it's appropriate, when it's not appropriate to use essential oils. And, with people who have intense skin reactions, for example, to medications or to an intervention they've received, there may be times where essentials are absolutely not indicated and, totally not appropriate. So we need to know when it's appropriate and when it's not. But one thing I would say is what I've seen over the years and why aromatherapy is so widely embraced, I think, is that the cancer journey is so terrifying and people are on a journey into the unknown. So they've lost their way. They don't have the familiar beacons to cling on to because they've stepped into this unknown journey. And so when people are cast adrift and they're on this roller coaster with no control because the treatments are undergoing and they've got all these protocols and they've, been bombarded by different people in different directions, all focused on the cancer, and then you have your aromatherapy and your massage focused on the person, what the aromatherapy does is very simply give them something to hold on to because it brings familiarity. So you can bring the aroma from home into the hospital or into the clinical setting. You can bring the aroma of Granny's apple tart into the, into this setting where everything is unfamiliar and new and scary. You're actually bringing something in that helps anchor people. It gives them a sense of security because that's something, at least they know it, they recognize it, they like it, and they can hold on to it to help them through.
Wonderful. Wonderful. So, of course, as you were talking, that just made me think about our estheticians and skincare. And obviously, when people are in treatment for cancer, the skin can so reflect the imbalances that are going on in the body as it's coping with the kind of chemical regimens that they have to endure. But if we think about the skin as the organ of intake for the aromatherapy, obviously skin integrity is important. But are there ways that aromatherapy can benefit the skin?
There are. In terms of the physical properties of the essential oils and pharmacological actions, yes, there are certain oils that you could say are anti-inflammatory or antioxidant or cicatrisant that can be used very specifically to help skin repair. But I would also draw your attention to another annex of aromatherapy or another part of the aromatherapist toolkit, which is really exciting for skin issues to do with cancer care, and that is the use of hydrolats. So what your essential oils are those concentrated extracts of the aromatic plant that you are usually getting through distillation or expression if it's a citrus fruit. But you also, through distillation, obtain a distilled water. It comes across at the same time as you're extracting the essential oil. And that distilled water we call a hydrolat or a hydrosol. I think you maybe in the States, you're more familiar with that term. And those waters are aromatic, but extremely dilute in terms of the aromatic components that are in solution in that water. But my goodness, are they amazing for inflammation and for taking the heat out of skin, for example, post radiotherapy. And also for general skin management, there is huge potential for hydrolates and hydrosols in our environment in cancer care. So the essentials are concentrated, so you have to be very careful of how to use them. And there will be times that you cannot. We don't advise essential oils being used on the skin immediately, for example, prior to radiotherapy. And there are protocols in place, and there are safety guidelines, of course, with essential oil use. But your waters, the hydrolates, really have a place, which is extremely exciting and has been growing over the years to make a big difference at the bedside.
That's wonderful. That is really, really wonderful. Thank you. I just took some notes because I have to teach a class where I include aromatherapy. So I was like, all right, we must look this up so I can talk a bit about it with my students in terms of, giving them some guidance, but also some interest in the area of aromatherapy and what they can do. Both my massage students and my oncology massage students would love this information. So thank you for that. So I guess the last thing I want to ask you is, I read that you came up with this concept for using inhalers in oncology and palliative care. Can you talk to us a little bit about how you came up with that approach? Did you have to do research and trials? Are they now kind of standard, I guess, methods of care in certain places?
Yeah, it's interesting because, it's almost like aromatherapy's come full circle because, aromatherapy, in the beginning, people would say, oh, that's, the smelly things, and that's the therapeutic part of what we do. And then we've gotten all serious over the years, and we've gone into the pharmacology and the chemistry and the research behind essential oils and how they work on the body. And a lot of the aromatherapy training over the years has gone deeper in that direction, but left off this important part of the aroma impact of the oils. Sort of putting that to one side, saying, oh, that's not as important now as the chemistry and the research. But now what we've seen is that we're coming full circle and we're putting the aroma back into aromatherapy as an aroma alone strategy. So before we were, putting them on the skin and we were combining them with massage and we were really thinking of applying them to the body, and that the aroma part was sort of secondary almost. But now we're actually saying these are potent tools on their own. If they're used just for their aroma, just through inhalation, they still are really, really potent. And how this came about was I was living in Singapore at the time, and that was back in 96. And I came across blank inhalers, like the Vicks Vapo inhalers that many people are familiar with. But I actually came across blank ones with a wick inside that I could add essential oils to. And my very first patient that I used was a man with liver cancer. So very quickly, I started to see the benefits of a simple tool of giving somebody a pre-blended stick that was made just for them according to their odor preferences, and to create together that would become then their tool for self-care in between treatments. Because I think if you look back in aromatherapy research and massage research, it shows that yes, you get benefits, you get psychophysiological benefits of your treatment, but they are short-lived. And so they have to be repeated frequently for you to get longer lasting benefit. And that always bothered me. And I was always asking myself, how can we make the bridge between the treatments the person is receiving and helping them manage in between. How do we connect that? And this is where the aroma sticks came in, really, because what they do is they help prolong the treatment for the reasons that I mentioned earlier on, that if you can anchor your physical experience of your treatment with the aroma, and then you can give that person the aroma to use, they will still get benefit, even if the therapist is not physically present. And that's made all the difference. So what then happened was I started teaching in cancer care at the Royal Marsden Hospital in London. I was teaching at their request. They have a very long established program for complementary therapy delivery. But they brought me in because they said, we're doing great things with aromatherapy, but we want to go an extra mile. There are certain areas where we just don't feel we're being effective enough. And it was in the very first class, and I think that was in 2002, 2003, maybe. I can't remember the exact date now, but it was there that I showed them the blank inhaler. And I said, what do you think about this? Could we do something with this? Would this not be beneficial? Because this is individual patient delivery. It's not diffusion. We're getting around problems of using aroma in large spaces. Could this be personalized self-management tools? And that's how it began. And from there, from that first course, then people found where to get hold of them and then started to use them. The Royal Marsden Hospital, I think, was the first hospital to integrate them in their unit for complementary therapy. Then the Christie Hospital in Manchester picked that up and they ran with it. They're a specialist cancer centre as well. And now in all of the active cancer treatment centres in the UK, as well as most of the hospices, this has just been rolled out, and aroma sticks are now used extensively, not just for patients, but for staff, for carers, for, they've been used for all sorts of things now. So it's really cool. I'm very excited about it because just something so simple and something so cheap, it was actually cost effective as well to do. Because once the stick is made, you have several months of use. So the sticks themselves have evolved with time because the main type of stick is plastic. And of course, we want to get away from plastics. And, maybe essential oils interact with plastic over time. So we're trying to find ways now of how to have different types of inhalers that are more friendly to the environment, but also, but still cost effective. But what it also did was it opened the door to aroma alone strategies. It reopened that door to the fact that we can just use aromatherapy for inhalation. And so now we have not only aroma sticks, but we also have all sorts of other gadgets that are aroma alone devices. For example, in the States, you have the amazing BioS aroma patches, which are these little discs that can be stuck on the skin, and they are like a mini diffuser disc that the person can be inhaling, or it could be put on their wrist so they can smell it as and when they need to. The aroma patches have really taken off as well. And there are other aroma alone devices now that are on the market. So they came in at the right time and got us thinking once again about the power of smell and really the profound impact that has on our health and well-being.
That's wonderful. So as an aromatherapist, have you found that the conventional medical community has really been ready to collaborate with you about the benefit that aromatherapy brings to patients?
I'd say yes and no. It is a bit of a mixed bag, but really what we need is an increased evidence base. And so the more reporting in the literature that comes about, and now for the use of aroma sticks, we have some great evidence. We've got good data now. So it's quite easy to argue the place of aroma sticks now in a clinical setting. So the more evidence that we have, the more that people report on benefits and publish those benefits, the better it is for all of us in the community. But, there are always, sticky points, and aromatherapy is still seen as sort of something fluffy and fuzzy and just a bit of a treat. But you know what? If somebody says, oh, aromatherapy is just something that makes me feel good or smells nice, actually, that's a compliment in itself for me, because if that's all I can do is give something simple and familiar and pleasant, I know that whole stress reducing cascade kicks into place. So for me, that's enough. I'm not into arguing my place. I just see the benefits with patients and encourage other people to do the same.
Wonderful, wonderful. Oh my goodness. This has been so amazing. I've learned so much. And now I just have like 25 more questions for you, but for another episode. But I really want to thank you so much for talking with us today. This has been an absolute pleasure. And I just want to say thank you.
Oh, well, thank you too, Erica, and to everybody at the Society for Oncology Massage and all of the therapists that you have as members, because you're doing just such great work around the world. So yes, happy to come back, happy to support you in whatever way I can, and let's stay connected.
Thank you. All right, collaborators, have a great day, and I hope you enjoyed today's podcast.
Thank you for listening to S4OM's Collaborative Connections podcast. If you found the information we shared today insightful and valuable, share this episode with a friend, or let us know you love this episode by tagging us on social media. Our goal is to bring the oncology massage community the latest research, education, and best practices possible. We love hearing from our listeners and welcome your thoughts and suggestions for future episodes. If you have any questions or feedback, you can email us at podcast@s4om.org. Until next time, thank you for listening.